We'll discuss regarding main disorders of menstruation. See, normal we discussed how menstruation is going on, what are its phases we discussed, right? So later abnormal thing we discuss. What are menstruation disorders? If abnormal thing happens, if it is any infection or is any hormonal change, what are all the problems, what are all the changes happens, what are all the disorders happens, we'll see. So first disorders of menstruation, right? In this session we'll discuss. Yes, today I'll discuss in this disorders of menstruation two main disorders which are very important and stressed out and pointed out in the staffness examinations as well as in the regular GNM and BSc nursing examinations. I'll just stress out two main disorders. Those are number one, amenorrhea, and number two, yes, number one amenorrhea and number two dysmenorrhea. First one we'll discuss with amenorrhea in detail. Yes, amenorrhea is nothing but missed periods. That means missing of one or more periods. Clear? In short, this is a normally amenorrhea. What is amenorrhea? Missing of one or more periods. Okay, missing of one or more periods. Right. This is of again two types: primary amenorrhea and secondary amenorrhea. Yes, one is primary, one is secondary. In primary, what happens is primary. See, for example, if a girl attained menarche is nothing but her puberty, right? So, if a girl attained her menarche, that means first menstrual period, attained her at the age of 12, if you say. Normally menstruation is attained normally at the age of 12 to 13, right? So if you think like a girl attained her menarche at the age of 12, so for the next month she is not getting a period, yes, or for the later period she got like that. In the initial stages of her puberty, initial stages of her menstrual periods, if at all if she miss one or more periods, then it is considered as primary amenorrhea. Missed period in the initial stages of puberty. Or at the age before 14. Clear? This is what primary amenorrhea. It is considered as a missed period in the initial stages of puberty. That means whenever she attained the menarche in the initial stages, initial months, if she missed a period of one or more, then or at the age, if you are not able to remember this initial stages of puberty, like you can consider as age before 14 to 15 after attaining the menarche. Clear? This is called the primary amenorrhea. Then next, coming to secondary amenorrhea is what is, see for example, a girl attained the menarche at the age of 12. So up to the age of 15 or 16 she's having a regular periods, yes, but at the coming at the age of 17 she missed the period for about 3 to 4 months, then it is considered as secondary amenorrhea. Missed period at the missed period, if she got a missed period at regular at the age after several months, then it is considered as missed period. Secondary amenorrhea, sorry. Yes, this is what secondary amenorrhea. Missed periods of 2 to 3 months. Missed periods of 2 to 3 months after several months of regular periods. See, as I've told you, if at all she's having regular periods for about years, that means 4 to 6 years after attaining a menarche. But coming to certain time, like for example, if you see 17, the age of 17, if she missed a period of 2 to 3 months, then it is considered as secondary amenorrhea. Clear? Then next we'll discuss in detail what are all the causes, risk factors of this primary and the secondary amenorrhea. Clear? Then next, if you see the causes, etiology, see here causes might be like due to genetic or hormonal changes, or changes within the changes within the female reproductive structures. Those are all the causes of primary amenorrhea. See, hormonal changes in the sense like changes in the hormones released from the hypothalamus, anterior pituitary, and genetic reasons. If you consider genetic reasons from the genetic problems considering to the ovaries, and next in the ovulation process, if you consider, then next reproductive changes, any missed organ within the female reproductive system, then it is considered as you see primary amenorrhea. So what are all the causes we discussed? First one, it is genetic reason. Second one, hormonal. Then next, structural changes in the female reproductive system. Clear? Structural changes in the female reproductive system. These are all some causes for the primary amenorrhea. Genetic, if you see genetical changes within the ovaries, and hormonal, if you consider any imbalance in the secretion of hormones from the anterior pituitary or hypothalamus, or if you consider estrogen and progesterone. Then next, structural changes in the female reproductive system is if there is any missed organ within the female reproductive system, it might cause primary amenorrhea. Clear? Then next, secondary amenorrhea causes. What are all the causes? If we see, like if is any having infection, if there is any having infection within the female reproductive system, it might get primary amenorrhea, that is a missed period. Clear? Then next, if you here, if there is any infection or related to female reproductive system or any disease, if there is any like a prolonged infection from the female reproductive system, it is considered as secondary amenorrhea. Clear? This is one cause.